loss or bariatric surgery, what is it and why is it done? This is the question I will be answering in this episode of Ask Dr. Chop Weight Loss Surgery Series. Hey wellness warriors, welcome back to my channel. This is Auntie Z, registered dietitian and nutritionist at the African Nutrition Institute, empowering you to chop better, make your body the answer. If you have been wondering how people lose weight through surgery, or if you are considering weight loss surgery and you are confused about what it is all about, what does it do, how does it help, why is it done, who is eligible, how much does it cost, what are the potential risks and benefits, then this series is definitely for you. So you may consider subscribing and sharing this video so that others may benefit and make informed decisions as well. First of all, what is weight loss surgery? Now, if you asked a doctor, he or she will tell you that weight loss surgery, otherwise known as bariatric surgery, is definitely a procedure done to an obese or overweight person in order to help them lose weight. So it's an option for weight loss. Now, how exactly this procedure is done is a topic that we will cover in another video. So stay tuned. But first, let's talk about what weight loss surgery is not. One, it is not a shortcut to lose weight. Two, it is not a replacement for healthy dietary and lifestyle behaviors. Now, medically speaking, weight loss surgery actually is a term used to describe a variety, not just one procedure, but a variety of procedures done for specific persons dealing with overweight and obesity. Now, before you start jubilating saying, yay, I'm overweight, so I am eligible, hold up. Wait a minute. I'm so sorry to burst your bubble, but this procedure will not be done to just anyone simply because they are overweight or obese. At least not in Germany, where I live and work as a state-registered dietitian and nutritionist. So who can qualify? Who can qualify? Who is eligible for weight loss surgery? Now, whether bariatric surgery is right for you depends on your BMI, body mass index, and your coexisting conditions. Let me explain. To be considered eligible, you must meet the following criteria. Number one, you have exhausted all other scientifically proven weight loss options. And by this, I mean you have tried healthy eating, tried physical activity for at least 6 months, but have not been able to lose a certain amount of weight with your personal endeavors. Number two, your BMI, your body mass index, must be within the ranges 35 to 39. Now, a quick refresher for those who do not know the BMI or what BMI is. BMI is a measure that uses your height and your weight to work out if your weight is healthy. So for most adults, an ideal BMI is going to be within the ranges 18.5 to 24.9. Okay? So what does this mean? It means that if you're below 18.5, you're underweight. If you're within 18.5, 24.9, you have a healthy weight. Between 25 and 29.9, you are considered overweight. Now, from 30 and over, you're in the obese range already. Now, in addition to having a BMI equal to 30, but up to 39, you must have one or more obesity-associated comorbidities. For example, type 2 diabetes mellitus, congestive heart failure, sleep apnea syndrome, gastroesophageal reflux disease, asthma, etc. Then you will be considered for weight loss surgery after an individual evaluation by a physician, especially if conservative therapy, that is healthy eating and physical activity, has been exhausted. Your body mass index must be equal to 40 to be considered without comorbidities. So you have other categories, classes of morbid obesity, class 1, class 2, class 3, as you can see from the image right now. So if your body mass index is equal to or greater than 40, even if there are no concomitant diseases and or no contraindications, weight loss surgery will be considered as a weight loss option for you because you are considered in the obese class 3 or in the morbidly obese category, which is a very dangerous place to be health-wise. Number 3, you have a BMI of 35 plus with comorbidities and you have undergone a multimodal concept for the treatment of morbid obesity, and that too has failed to help you lose weight the natural way. Now, I can only speak of these options referring to the German guidelines, as I'm licensed only here. So according to the German standards, before surgery can be considered and planned, a multimodal treatment must first be carried out. This multimodal treatment includes nutrition, exercise, and behavior therapy for at least 6 months, among other things. So basically, your doctor will refer you to a state-registered dietitian or a certified dietitian nutritionist like me, who will counsel you for 6 months on how and what to eat for weight loss, on physical activity for weight loss, and how to change your behavior to lose and maintain a healthy weight. If within this time frame of 6 months, counseling also fails, you will be considered for weight loss surgery. Number 4, to every rule there is an exception. So let's talk about the case of severely obese persons. Say Misodi Onkechi is severely obese, meaning her BMI is about, say, 61. What doctors will do in that case is to assess her state of health. If she has type 2 diabetes, for example, and or has problems breathing, also has other secondary diseases that do not permit postponing surgical intervention, her case will be different, because in her case, it is a matter of life versus death. Such cases will be assessed individually, and the doctor can decide not to waste time, not to waste 6 months doing multimodal therapy, and just decide to operate almost immediately, because it is a case of life and death. So again, in special cases, operation might be done without much delay if the patient has a BMI greater than or equal to 60, if conservation therapy or conservative therapy, healthy eating, exercise, behavior therapies have been classified by the multidisciplinary team as not promising or hopeless, if postponing surgery would worsen the patient's prognosis, if the patient has severe concomitant diseases like type 2 diabetes and secondary diseases that do not favor postponing surgical intervention. Now, if one or more of these factors mentioned apply, the patient will be considered for weight loss surgery immediately. Now, that being said, to know if you truly qualify, please speak to your healthcare professional and make sure to get extensive and detailed counseling, because this procedure is not something to play with, no be butter. And if you would like to know the different types of weight loss procedures done to help obese persons lose weight, please subscribe to my channel for the video dropping next week on this weight loss surgery series. And don't forget to like, share for more content like this, and I will see you in the next video. Remember to chop better, make your body day answer.